Morphine sulfate vial is a medication used to treat severe pain. It belongs to a class of drugs known as opioid analgesics. It works in the brain to change how your body feels and responds to pain. It is important to follow the dosage prescribed by your doctor and take it at the recommended times for optimal pain relief. Always consult with your healthcare provider for the best timing to take this medication. When using morphine sulfate vial, follow your doctor's instructions carefully. This medication can be given by injection into a vein, muscle, or under the skin. Preservative-free morphine may also be given as an injection around the spinal cord or into the fluid-filled space that contains the spinal cord. If your doctor directs you to continue using this medication at home, it is usually given as a continuous injection using an infusion pump placed under your skin. The dosage is based on your medical condition and response to treatment. For children, the dosage may also be based on weight. Do not increase your dose, use the medication more often, or use it for a longer time than prescribed. Pain medications work best if they are used when the first signs of pain occur. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. If nausea occurs, consult your doctor or pharmacist for ways to decrease it. Suddenly stopping this medication may cause withdrawal, especially if you have used it for a long time or in high doses. When this medication is used for a long time, it may not work as well. Your doctor may need to increase your dose or change your medication. This medication may sometimes cause addiction, so use it exactly as prescribed to lower the risk. Tell your doctor if your pain does not get better or if it gets worse. If you are experiencing nausea, vomiting, constipation, lightheadedness, dizziness, or drowsiness after taking morphine sulfate vial, it is important to talk to your doctor or pharmacist. Pain, redness, or swelling at the injection site may also occur. To prevent constipation, make sure to eat dietary fiber, drink enough water, and exercise. You may also need to take a laxative, so be sure to ask your pharmacist which type is right for you. To lower your risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed to you because the benefit to you is greater than the risk of side effects. However, if you experience serious side effects such as interrupted breathing during sleep, mental/mood changes, difficulty urinating, vision changes, or severe stomach pain, be sure to contact your doctor right away. It's also important to seek medical help immediately if you experience very serious side effects such as slow/shallow breathing, fainting, severe drowsiness, or seizures. While a serious allergic reaction to this drug is rare, it's crucial to get medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, be sure to reach out to your doctor or pharmacist for further guidance. And remember, always consult with your healthcare provider for personalized advice. Morphine sulfate vial is a medication that carries a risk for abuse and addiction, which can lead to overdose and death. It may also cause severe breathing problems. To lower the risk, your doctor should prescribe the smallest effective dose of morphine and use it for the shortest possible time. It's important to ask your doctor or pharmacist if you should have naloxone available to treat opioid overdose and to educate your family members about the signs of an opioid overdose and how to treat it. The risk for severe breathing problems is higher when starting this medication, after a dose increase, or if the wrong dose/strength is used. Using morphine with alcohol or other drugs that can cause drowsiness or breathing problems may cause very serious side effects, including death. Knowing how to use morphine and what other drugs to avoid is crucial. Seek medical help right away if you experience slow/shallow breathing, unusual lightheadedness, severe drowsiness/dizziness, or difficulty waking up. Keep this medicine in a safe place to prevent theft, misuse, or abuse. If someone accidentally uses or swallows this drug, seek medical help immediately. Before using this medication, women of childbearing age should discuss the risks and benefits with their doctor. It should be used during pregnancy only when clearly needed, as it may slightly increase the risk of birth defects if used during the first 2 months of pregnancy. Using it for a long time or in high doses near the expected delivery date may harm the unborn baby. To lessen the risk, use the smallest effective dose for the shortest possible time. Babies born to mothers who use this drug for a long time may develop severe withdrawal symptoms. Notify the doctor right away if you notice any symptoms in your newborn baby, such as crying that doesn't stop, slow/shallow breathing, irritability, shaking, vomiting, diarrhea, poor feeding, or difficulty gaining weight. If you are allergic to morphine or other opioid medications, or if you have any other allergies, talk to your doctor or pharmacist before using this medication. It may contain inactive ingredients that can cause allergic reactions or other problems. Before using this medication, make sure to inform your doctor or pharmacist about your medical history, especially if you have any brain disorders, breathing problems, gallbladder disease, kidney or liver disease, mental/mood disorders, or a history of substance use disorder. Also, let them know if you have stomach or intestinal problems, pancreatitis, or difficulty urinating. This medication may cause dizziness or drowsiness. Avoid alcohol or marijuana as they can make these effects worse. It's important to not drive or operate machinery until you know how the medication affects you. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications you are taking. Older adults may be more sensitive to the side effects of this medication, so be cautious of confusion, dizziness, drowsiness, and slow/shallow breathing. If you are pregnant, only use this medication when clearly needed and under the guidance of your doctor. It may harm an unborn baby. This drug can also pass into breast milk and may have undesirable effects on a nursing infant. Consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking morphine sulfate vial. Always keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Certain pain medications, naltrexone, and samidorphan are some products that may interact with morphine sulfate vial. Additionally, using this medication with other products that may cause drowsiness or breathing problems, such as opioid pain relievers, alcohol, marijuana, or muscle relaxants, can increase the risk of serious side effects. It's important to check the labels on all your medicines and ask your pharmacist about using them safely. Also, be aware that this medication may interfere with certain lab tests, so make sure lab personnel and your doctors are aware that you are using this drug. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much morphine sulfate vial and is experiencing severe symptoms like passing out or difficulty breathing, it is important to give them naloxone if available and then call 911. If the person is awake and not showing any symptoms, it's important to call a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of an overdose may include slow or shallow breathing, severe drowsiness, or even coma. It is important to seek medical help immediately if these symptoms occur. Remember, this medication is prescribed specifically for your current condition. It should not be shared with others or used for a different condition without your doctor's guidance. If your doctor advises you to use a different medication for another condition in the future, make sure to follow their instructions. If you are using this medication regularly and happen to miss a dose, take it as soon as you remember. However, if it's close to the time for your next dose, then you should just skip the missed one and continue with your regular schedule. It's important not to take a double dose to make up for the missed one. As always, it's best to follow your doctor's guidance on the best time to take this medication and the appropriate dosage for your specific condition. When storing morphine sulfate vial, make sure to keep it at room temperature and away from light. Different brands of this medication may have different storage requirements, so be sure to read the package labeling or ask your pharmacist for specific instructions. It's important to keep all medications out of reach of children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the vial when it is expired or no longer needed. If you're unsure about the proper way to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.